Okay, and welcome to Chapter 37, Administering Intradermal, Subcutaneous, and Intramuscular Injections. Advantages of injections, which, by the way, parenteral again means not through the gastrointestinal tract. Advantages of injections include bypassing the gastrointestinal tract, rapid onset time compared to the oral route, ease of administration to uncooperative or unconscious patients, and better absorption of drugs that are poorly absorbed via the oral route. Disadvantages of injections include they are invasive and uncomfortable for the patient. They can be very expensive. They require additional supplies and equipment. They require qualified personnel to administer, and they also carry a risk of infection and nerve injury. This is talking about the supplies and equipment needed for injections. Of course, with syringes, there is regular syringes, and that is calibrated in milliliters, and they are in sizes of either 1, 3, or 5 ml syringes. There are tuberculin syringes. They're smaller in diameter. They hold only a total volume of 1 ml, and they're calibrated in tenths and hundredths of a milliliter. And then the insulin syringe, of course, is similar in size to the TB syringe, except that it's calibrated in units of insulin and used only for injecting insulin. And then the last one there is the pre-filled syringe. And pre-filled syringes are single-dose, ready-to-use disposable syringe cartridges that need to be attached to a needle, and then they're inserted into a reusable plastic holder for administration. And we can show you those in the lab. I don't think we've shown anyone in the lab. Of course, we've learned that we should never ever recap needles. We use the swoop method to put the cap on, or we use the safety. The parts of the syringe that need to be kept sterile include the plunger, the inside of the barrel, the syringe tip, and the needle cannula. The cap does not have to be kept sterile. And of course, the needles come in different lengths and gauges. We've talked about how the gauge of a needle refers to the diameter of the needle, and it's indicated in numbers. And the lower the number, the greater the diameter of the needle. And then the length of the needle. And of course, for intradermal injections, we want to make sure that the needle is bevel up. We insert only until the bevel is under the skin. We give it at a 10 to 15 degree angle. We use a 26 to 27 gauge needle and a 3/8 to 5/8 inch length needle for intradermal. Subcutaneous, we use a 23 to 25 gauge needle, 1/2 to 5/8 inches long, and we insert at a 45 degree angle. And then intramuscular, we use a 20 to 23 gauge needle, 1 to 1.5 inches in length, and we give that at a 90 degree angle. Prior to the injection, you want to make sure you have everything all ready to go. First, checking the doctor's order to make sure you have everything ready as it has been ordered. Gather all the supplies that you need before beginning the preparation of the injection. You always want to maintain asepsis and making sure that you are preventing needle stick injuries by not recapping the needle unless you need to, and you use the one-handed scoop to prevent the needle sticks. And you always want to put the needles into the sharps container, and you don't want to set the needles on the table needlessly. You want to make sure you've drawn them up, injected them, and then put them into the sharps container right away. There are different size vials. There are multiple versus single dose vials. In the lab, we've been using multiple dose vials. Some of the single dose vials include the vaccines. For example, measles, mumps, rubella, or MMR vaccine will come in a single dose vial that needs to be diluted with something called the diluent, which is usually some sort of sterile water or sterile saline, and it comes in the same size single dose vial as the actual vaccine, which can come in a powder form. And you want to make sure that the correct amount of diluent is added to the powder in the single dose vials. We've been able to practice withdrawing medication from a vial in the lab, and that is detailed specifically on page 831 in your textbook, and we'll continue to talk about that in the lab. Again, ampules. You've all had an opportunity to learn about ampules and to practice drawing up medication from ampules in the lab, which is kind of nice that we've done that already. And the biggest thing with the ampules is to remember that you need to use a filter needle to filter through any possible glass shards, since the ampules are glass, and then you'll need to switch over to another needle. Which term is used for a small sealed glass drug container that must be broken to withdraw the medication? And of course, we know that's an ampule. It's a small sealed glass drug container that must be broken to withdraw the medication. To prepare the ampule for withdrawal of medication, tap the top of the ampule to distribute the medication to the lower portion of the ampule. These next two slides are talking about mixing medications. That's not something we'll do a lot of this semester, but prior to mixing medications, you'll want to check the compatibility of the two medications. If they're incompatible, it might cause an unwanted reaction between the drug and the solution. And you'll use a vial and a syringe to mix it. There's two different methods of mixing medications from pre-filled syringes. So first, either draw the medication from the pre-filled cartridge into a separate syringe, or mix both medications in the cartridge. These are the routes of administration, and we have talked about those already. The typical intradermal injection site is the ventral forearm for the TB skin test. And then we also talked in lab about some of the other intradermal injections are on the back for allergy testing. Subcutaneous injections are typically given on the back of the arm, in the fatty portion of the arm, and the abdomen is another common place to give subcutaneous injections. Which of the following describes an intradermal injection made under the layers of the skin into the subcutaneous tissue, administered into the deep muscle tissue, small amount of fluid is injected into the dermis, useful when slow and continuous absorption is required? And of course that answer is C, small amount of fluid is injected into the dermis. An intradermal injection is the injection of a small amount of fluid into the dermis or true skin layer immediately below the epidermis. It's commonly used as a diagnostic tool, such as testing for allergies or tuberculosis. And this table is on page 837 in your textbook. It's tips for safe insulin and heparin administration. So with insulin, monitor a finger stick blood glucose or serum glucose levels. Use a syringe matching the strength of the insulin. Have a second and a third nurse verify that you have the correct type of insulin and the correct dosage drawn into the syringe. Don't aspirate before injecting insulin. Don't ever massage the site after removing the needle. And monitor the patient for signs and symptoms of hypo and hyperglycemia. With heparin, you want to assess lab results, the prothrombin time, the international normalized ratio or INR, and partial thromboplastin time before administering. After checking the heparin label against the medication administration record 3 times, and then check it again, have a second and a third nurse verify that you have the correct strength and dose of heparin drawn into the syringe. Don't ever aspirate before instilling heparin. Don't massage the site. And monitor the patient for bleeding gums, red blood cells in the urine, blood in the stools, and excessive bruising. So again, that top number you want to, or the top point there, assessing the lab results. So those are typically known as the PT, the INR, and the PTT results. And when you're administering insulin, you want to make sure you're rotating sites. Intramuscular injections. Injection directly into the largest portion of the muscle. We administer those at a 90-degree angle. And it's used for irritating or caustic drugs and allows for administration of larger volumes. Remember, we can up to 3 mLs in one injection. Ways of preventing complications for intramuscular injections. Make sure you wash your hands before you begin to prepare injections. Wash your hands after you enter the room. Make sure you clean the injection site with alcohol or a facility-approved antiseptic. And then also cover the puncture wound with a new bandage. Also with the IM injections and any other injection, you want to make sure you document the injection site. If when you aspirate with an IM injection, if you aspirate blood, you want to withdraw the needle, dispose of the syringe, and begin all over again with a new dose and a new needle. And the 2 preferred sites for the IM injections are the ventrogluteal and the deltoid. Make certain you review the patient's medical record, rotate the sites if they are getting several injections. Use the smallest gauge needle that's appropriate within that right range. Make sure the needle puncture is swift and at the correct angle. Apply a cotton ball, gauze pad, or alcohol to the website and apply a cool pack. A couple more things about the IM injections before I talk about the Z-Track, which is also one of the methods of an IM injection. But in general, IM injections might be contraindicated if the person is taking aspirin, acetaminophen, or supplements like ginseng that cause bleeding. And then the other thing is I'm ahead of myself in the next slide, but I just want to make sure list the preferred sites on the next slide, and those are ventrogluteal, which again we already mentioned, and the deltoid, the vastus lateralis, which isn't used very often. The rectus femoris is used for self-administering meds that need more rapid absorption. and then dorsogluteal. So make sure you look at all those sites. There's nice pictures in your book of the ventrogluteal. So the Z-Track method prevents irritating and dark colored medications from leaking out of the injection site into subcutaneous tissue. And you're basically going to pull the skin over a couple of inches, give the injection, hold it for 10 to 15 seconds, and then you're going to release it. And again, as you'll read in your book, the purpose of the Z-Track medications is to prevent irritating medication that's in the injection, or dark colored medications that could stain, to keep those away from the subcutaneous tissue. And then again, here is the slide I had already mentioned. The ventrogluteal is the preferred site, and that rectus femoris is the site that's used for self-administering meds.